Kasura kapole, kenye upendo tangu nikuone. Kipenzi cha wote, unanyota kali acha tukuone. Kweli Mungu kakujalia, kila day baby na kusifia. Huna neno na umetulia, wewe mzuri my dear. Kweli Mungu kakujalia, kila day baby na kusifia. Huna neno na umetulia, wewe mzuri my dear. Basi simama tucheze.
Good evening and thank you for joining us from wherever you're watching us today. I am your host Loreen Kerubo and welcome to The Nest right here on Y254 TV, a show that aims to bring you interesting conversations, bold ideas and real-life inspiring stories. And on today's topic, we are talking about something that affects many families, not only in Kenya, but across and beyond. We are talking about dementia and brain health. Many of us have heard of the word dementia, but few know what it means to live with this disease or even understand how it feels to cater and care for someone going through this journey. And our guest today is someone who has dedicated her life in helping us understand that. Wambui Karanja is a researcher, psychologist and a passionate advocate for brain and mental health here in Eastern Africa and Kenya. She is also a Global Atlantic Fellow for Equity in Brain Health, where she's working to ensure dementia and research is done extensively and incorporated in our world today. She is also currently working with Brain and Mind Institute at Aga Khan University, where she leads initiatives focused on dementia risk education, caregiver support, and culturally relevant cognitive assessment tests. Beyond all these titles is a lady who believes in creating awareness on reducing stigma and building a foundation where people understand what it means to go through this disease, have the tools and resources required and needed to handle this disease. Please join me in welcoming Wambui Karanja to The Nest. Wambui, welcome, and it's such a pleasure to have you here.
Such a pleasure to be here. Thank you for having me.
Could you maybe briefly introduce yourself to us and tell us more about yourself? Who is Wambui Karanja in your own words?
Yeah, so as you heard, my name is Wambui Karanja. I'm trained as a psychologist. I'm also trained as an Atlantic Fellow for Equity in Brain Health. And my passion is in promoting brain health across the life course, not just for people who have dementia, mostly in later life. I have a personal experience of being affected by dementia. My dad lives with early onset dementia, and it's one of the reasons I do this work passionately.
Okay.
Yeah.
Could you maybe share a bit more about the work you've done at the Brain and Mind Institute? Maybe you could tell us what drove your passion. You've mentioned your dad.
Yeah. So that's one of the reasons. So some of the work, the first work I did was cognitive assessment tools. And cognitive assessment tools are tools that clinicians and researchers use to detect dementia early on. So they're questionnaires, and most of them are developed in the US and the UK and elsewhere. And when they come here, sometimes they're not appropriate. So they might have false results or about someone having dementia. So getting those tools ready so that clinicians have the appropriate knowledge on how to use them, and also just adopting them, translating them to Swahili so that they are accessible to our populations, using a simpler language, taking them through focus group discussions and making sure that like when people take them, we have a real life experience of how when a patient comes to the clinic, how they will be able to use those tools with a clinician. Additionally, we've started creating norms, and norms are whereby when you get a population of healthy adults, you take them through the tools so that you know how a healthy person performs among those tools. So that when someone who has a defect or has started developing dementia takes those tools, you know whether they fall within the category of healthy or unhealthy. Yes.
Okay, diagnosed or not diagnosed?
Yes, yes.
Okay, okay.
Yeah.
Maybe could you share with us, how do you hope that this work you're doing in Kenya and also maybe across the world, how do you hope that it would help bring an impact in creating awareness for dementia?
So first of all, I'll just speak about different population. In the clinician population, there is low awareness of dementia. Okay. So even our doctors and nurses don't really understand dementia. So that's one part of it. And when we're working with these tools, we're trying to make sure that when clinicians have these tools, they're able to use them. And also, they're able to use them, and we are able to make an early diagnosis of dementia, because when people get diagnosed with dementia, it's so progressed that they're not able to make decisions about their lives, understand their own diagnosis, which really affects the quality of their life, because later when they lose capacity, they can't make decisions for themselves. Someone else has to make those decisions for them. So having tools that can detect dementia early allows for an early diagnosis that allows for the person to have agency. They can understand their diagnosis and also have agency and make decisions about how they want to be looked after.
That is a very good explanation. You've also been involved in very many projects in relation to the same. Maybe you could take us through some of the projects that you've done at the Brain and Mind Institute. Tell us how they've affected dementia risk reduction and maybe the care for dementia.
Yes, so until recently, people thought dementia could not be prevented. And globally, we are seeing data and research showing that we can reduce the risk of dementia and prevent dementia. And that's an exciting trajectory for a young population like Kenya, because if we can reduce dementia, which is a devastating disease, then as the population grows older, then we are able to reduce the number of people who develop dementia in later life. So one of the projects I did was called Africa Fingers, which is an exciting, pioneering project across the African continent. And the project did was it's a randomized controlled trial where you pick people at risk of dementia, and people at risk are taken through behavioral interventions, good diet, physical exercise, social engagement, managing of their symptoms of managing of their health, and also cognitive stimulation. So they do things that are cognitively stimulating, and then they're followed over 2 years, and we see whether they
2 years.
Yes.
Okay, that's a period.
Yeah. So whether there's any change in their risk profiles.
Okay.
Yes.
And these cognitive assessments that you do, maybe you could take us through and tell us, how do they improve the dementia diagnosis, especially in Kenya? Have they brought an impact to the program? Have they had a slow impact to the program?
So it's very early impact. Very, very early impact in that it's foundational work, which will be very crucial in doing the work on dementia in the future as the population ages. In that, like, you can't do research, you can't even do prevalence studies and incidence studies of dementia. So knowing how many people have dementia in a population, if you don't have a way to test for dementia. That's why it's very foundational work. So when you have good tools, when you have robust tools that can test for changes in people's thinking and behavior changes as they grow older, then you're able to do bigger studies that have more impact. So at this point, just having those tools ready, appropriate for the population, is a huge impact in itself. Yes.
You're also leading like an awareness initiative
Yes.
for the same, brain
Yes.
health.
Yeah.
Maybe you could tell us what strategies make these campaigns effective in your line of work, and how is it engaging for the communities you've worked with?
Yeah.
Yeah.
So one of the initiatives I'm currently doing is training journalists around understanding what brain health is.
Okay.
And it's really important that we have correct and effective and accurate reporting about the conditions that affect the brain.
Yeah.
Because they are behavioral issues, and those issues are usually related to relate to stigma in the society, that people are put aside, people are mistreated, they're abused, they're isolated in the society. And if we can report appropriately about brain health and dementia and all these other conditions that affect the brain, then we are able to create a population level health information, giving information that's accurate, so that like we reduce stigma, but then also help people start to know what they can do. And one of the things that we're not just focusing on dementia, we're focusing on brain health across the life course. And as I said,
general.
yeah,
Yes.
and as I said earlier, because brain health that just doesn't start at old age, it's a life course approach. In utero for a pregnant mother, when the child is born, when they go to school, in their teenage years, in their early adulthood, in their adult years.
It's a process.
It's a whole process. And if you have a risk at the very early age and then it starts accumulate, it increases the risk of you developing dementia.
Okay.
Yes.
So maybe you've mentioned something about the stigmatization, and I feel like dementia is a disease which is generally misunderstood because you're not sure if someone has actually forgotten because they're of old age, or they're actually going through a certain disease inside them. Maybe you could tell us, how can we reduce stigma around dementia in our communities so that we can openly talk about this and have people bring those who have dementia close and understand them better. Could you please just let us know how we can, reduce the stigma? Yeah.
First of all, it's understanding causes of behavioral issues. I think we tend to use very negative language when we talk about people who have mental illnesses and people who have dementia. And the negative languages, I don't want to know whether I don't want to repeat it here. We know how we say when someone is showing serious signs of dementia and also distress in their life. They're forgetting, they're unable to look after themselves, they get lost when they're in familiar places, and you're like, it's actually brain changes, it's physical brain changes happening in your brain. It's not, people say it's witchcraft or all these, or spiritual causes. There's nothing
spiritual
about it. It's a disease like when you have a flu or something else, but it has long-term consequences, and it's distressing. So of course it will cause fear in people around because you're not used to seeing that. So the thing people can do is really have empathy and understand that no one chooses to be in such a state. It's a disease that if you can look out for the people who have been affected, speak to them kindly. Sometimes they can their behavior can be violent, but it's not them choosing to
be that way.
To be that way.
Yeah, true.
It's something that has happened physically in their brain, like a scratch or a disorder that causes that behavior. So you have to have empathy and be very kind to them, support them. It's not easy because when we are relational, we want the other person to respond, and the other person might not respond the way we want. So just meet them at the point they are and then support them. And also for the people who look after those people, the families affected, be there for those families because they're also going through distress. They're losing someone they care about who is supportive, and it can be very difficult for those families. Yes.
And from what I'm hearing, it means that all this just begins with us as the people who are around the affected, the patients, for us to give them the grace and the care and the kindness to know that you're unwell, but we are here for you. And maybe you could give us ideas of what us as young people, because currently Gen Zs are the ones who are all over the place.
Yeah.
Maybe what role could they play in helping you to reduce this stigmatization?
So young people have access to broad information
Yes.
on the internet, and if you can, there's resources on YouTube, but then there's also resources that are not actually helpful. So resources from reputable organizations that give correct information, encouraging young people to access that information and also be agents of spreading awareness. So when they see an older person or their parent, someone in their family, they're like, wait a minute, this is a problem that we need to handle.
This is not right.
Yeah, this is not right. So one of the things that young people can do is using the information and understanding, seeking information on brain health, on dementia, and also just telling the people in their community that this is not part of normal aging. This is a disease, and this person needs support.
Yeah.
Yes.
Yeah. And maybe for those of us who are interested in what you're telling us and we want to get to be involved in this awareness, where do we start from? Where can we go?
So there are several organizations in the country that do amazing work on dementia. There's Alzheimer's and Dementia Organization Kenya.
Yeah.
There's Women for Dementia Africa. Those are two and also the NCD Alliance of Kenya. Those are three organizations that really are trying to advocate for people and people's lived experiences and to reduce stigma and to have support for people affected by dementia.
Yeah.
So if you can donate to those organizations so that like they're able to do the work. If they organize events, you can join them in the events, and also yes, and they have good websites where you can get correct information about these conditions.
You are also a Global Atlantic Fellow, for equity in brain health.
Yes.
Maybe you could share a bit more about that and your involvement in the organization.
Yeah, so as an Atlantic Fellow for Equity in Brain Health, it's truly like a life-changing experience. And what that is a one-year training program that trains you on how we can think about brain health in different aspects, from health policy to economics to lived experiences and actual neuroscience, how the brain actually is. So it's a training program that I've gone through, and what this has done is give me the opportunity to work globally with other people doing this work across different parts of the world, and even still here in Kenya, and be involved in projects that and cross learning across the globe around, like what are we doing in Kenya, what are we doing in Brazil, in India, in South Africa, and in other parts, and see where there is synergy
comes in,
where there's synergy and what we can learn from each other. Because we really, where we don't have services now, we don't have to start from scratch. Other countries have done really amazing work, and is it possible to replicate that in Kenya? And the fellowship is an annual thing, so if anyone is interested, they can apply every year and see whether they get the opportunity. The fellowship accepts people from cross disciplines, journalists, neurologists, psychiatrists, general practitioners, doctors, psychologists, anyone, like if you have an interest in brain health and dementia, and like you show leadership in that field, it's a very good training program.
A starting point for someone, for people like us, the young people who want to really join you in this movement and hold your hand as we walk through the journey. You've also mentioned that while starting this, there's something that spoke to you personally, aside from your interest as a person. You've experienced this through your father, and I read about you initially, and your father is your hero.
Yeah.
Maybe you could share a bit more about how that started for you, how it felt for you, the challenges you experienced. Yeah.
So my dad has early onset Alzheimer's disease, and early onset Alzheimer's disease is Alzheimer's disease that starts before the age of 65. So my yes, early onset. So his dementia started when he was in his early 50s. I was then a teenager and then a young adult, and I did not understand why my father was forgetting, and like I lost like the mentorship and the care that when you're growing up you need from your father because of him getting that disease. We got the diagnosis very late, so we didn't understand what was happening until the disease had really progressed, and we had to make decisions for him and like go through really difficult process. And I was like, I don't think this is how things should be. For when someone has a disease, they should have access to care, access to good information, and support from the healthcare workforce. So that's why I started doing this work. So my dad being my hero, it really seeing him go through that, not having the support systems, not having information, not having care systems for me and my family, is why I started doing this work really.
That's where you developed your passion and the values, and you decided, I'm going to do psychology.
Yes, I actually did psychology. I got into psychology before I understood what was happening with my dad. So it was like happening at the same time.
So you had already thought of doing psychology before this came into the family.
Yes, but it was very useful to start to understand like what was happening through my training. But then also through engaging with organizations. So psychology made it easier for me to get into the work on dementia, and
it gave you a starting point.
It gave me a start point,
Okay, okay, that's nice.
Yeah.
And being an Atlantic Fellow for Equity in Brain Health, I'm guessing this, in relation to your dad, created a platform where you could personally understand why you're involving yourself into the program. Have you shared this story with people as you're giving out maybe your starting journey? And how has it felt for you? Is your father proud of this? Is your father advocating?
Yeah. So as you know, dementia is a neurodegenerative disease. So it's so as the disease progresses, the person gets, my dad forgot me, he doesn't, he's not able to be present, he needs 24-hour care, which is taxing for my mom, who takes care of him. So I think he will be proud of me if he understood what I was doing, but it gives me a way to connect and to really have empathy for other people going through this. I can meet someone who their parent or their loved one has been affected by dementia, and when I tell them, I understand what you're going through.
You're talking from a point of, I've been here before.
I've been here before. I know how painful it is. I know how the loss really doesn't go away. So, and it also like allows me to do work that is person-centered. A person with dementia is having that personal experience. Being a secondary caregiver, I can be able to think like in my work. I can be able to think like someone, as someone who's gone through this. So if I'm developing a service for caregivers, I think about what didn't me and my family have. What resources didn't we have at the beginning? What information did we need? So I'm able to develop resources from my personal experience before.
And these are the resources and tools that are being used to hold other families to walk through this journey with you.
Absolutely.
Maybe you could share with me some of the long-term goals you aim to achieve from this, like in this field. Where do you see yourself in probably the next few years as far as dementia is concerned, and being an advocate for its understanding?
So where I see myself is being able to develop cost-effective resources and tools for both clinicians, for media professionals, for families, for people with dementia themselves, and being someone who's led in that work and creating a sustainable platform that allows people not to be scared of a diagnosis. When someone gets a diagnosis of dementia, they're like, I've got this. I have the tools to look after the person, to understand the person, to navigate legal challenges, to think about long-term care, end-of-life care, and also tools that lead to policy change that allows people with dementia and their families to live a dignified and quality life, because that's possible and it's been shown that's possible. So I don't know whether I answered that question, but I see
yes, you
in a few years as a leader, I want to be at the forefront of building those structures that last across time to support people in the Kenyan population and the African population to have.
I believe we're also looking into finding a community where everybody understands what dementia is, how to handle dementia, what is needed, and maybe also give out the basic education to those who are suffering from this and tell them, hey, you're not alone. This is something that everybody out here is going through it. And you know, in Africa, people tend to think of superstitious things like you've mentioned, witchcraft and other crazy things that really don't add up. And it's good to have someone like you who's going to give us a starting point and a base to understand dementia amongst many other diseases. And even as we're talking about dementia, maybe you could tell us, give us a disparity of this is dementia and this is Alzheimer's, because you've mentioned that your father was also experiencing the onset Alzheimer's disease. Maybe tell us the difference, because we've dwelled so much on the dementia side.
Yes, so dementia is an umbrella term. For
all this.
For diseases that affect the brain and they get worse over time. And I like to compare it with dementia and cancer. Cancer is an umbrella term of other cancers that affect different parts of the body. So you can have colon cancer, all these other cancers. And it's the same with dementia. There are many types of dementia that manifest in different ways. So Alzheimer's disease is a type of dementia, which is the most common type of dementia. And Alzheimer's disease tends to manifest in short-term memory loss at the beginning. So someone forgets something they've just learned and they can't retain that information. And then there is orientation. They're not able to understand their surrounding and familiar surrounding, and they get lost. And then there's thinking. They're unable to look after themselves in their daily lives. And it starts with that. That's the first sign of dementia, of Alzheimer's disease, is that early memory loss. And then there's other types of dementia, like vascular dementia, which tends to happen with people who've gotten a stroke or they've
had a medical complication.
With the brain, like especially stroke. And then there is Lewy body dementia, which has behavioral symptoms, sleep problems, behavioral symptoms, and also tremors. And then there's Parkinson's dementia, which comes along Parkinson's disease. And then there are others that can, there are many types of dementia, and these dementia sometimes can happen at the same time. An person with Alzheimer's disease can also have vascular dementia, and it's called mixed dementia. So it's that understanding that Alzheimer's disease is the most common type of dementia, but dementia is an umbrella term for several conditions that affect the brain and lead to neurodegeneration.
That is amazing information. We will hold it at, we'll hold that thought at Alzheimer's. We're taking a short break. Don't go so far. And we'll be here with Wambui when you join us back. Welcome back, and thank you for joining us. If you are just coming in, today we are talking about dementia and brain health in general, and I'm joined here by Wambui, who's going to give us so much more about this. Maybe let's talk about mental health. What are some of the simple ways that you can boost mental health in our society today, brain health.
Yes. So I'd like to say, like, brain health and mental health sit at different levels. They sometimes they're used interchangeably.
Yeah.
But brain health is more general. But boosting
Brain health.
mental health boosts your brain health. So first of all, it's boosting mental health and identifying stressors and being able to manage those stresses. My simplest and most precise understanding of brain health is our ability to cope with our environment, so our internal environment, like our emotions, and then our external environment. So it's identifying stressors and then being able to manage stress and being able to cope so that you can thrive in society. And one of the ways people can boost their mental health is social interaction. Being around people and having supportive groups of people, social engagement has been shown to boost mental well-being. Another one is physical activity. Exercising boosts your well-being and your mental health. A good diet, and also if you can afford it, go for therapy when you feel like something is happening, and then with your well-being. Yes.
You've mentioned a good diet.
Yeah.
Maybe you could share with us some of the healthy foods or diet someone could engage with in respect to improving your brain health.
So I'll speak about like the study done in Africa, in Nigeria, showed eating green leafy vegetables protects your brain from vascular.
Those being edgy
Yeah,
vegetables.
yes, and don't overcook them. So
Steamed.
yes, so eating green leafy vegetables, eating fruits.
Yeah.
People who have more fish in their diet have been shown to have. It has been shown to have sort of protective factors. No, we don't have enough data from the African continent, but omega-3 and those fats help boost your brain. And just having a balanced diet, not having too much starch, and then having more protein and vegetables in your diet promotes your mental well-being and your brain health.
Could you maybe share with us also exercises you can do to like boost your mental health aside from, you know, healthy living?
Exercises, I know people want to go for them, like, oh, let's meet people for the gym, but the simplest one is walking. Walking and making sure that you have cardio, your heartbeats, you taking the stairs, walking is the simplest form. If you can run, doing exercises that build muscle and also balance so that it prevents you from falls, because sometimes when you don't have balance, you might fall, injure your head. That affects your brain health. But walking, running,
Simple things to just move your body around.
Move your body around.
Yeah.
And making sure that you build muscle and doing cardio exercise will boost your mental health.
And what are some of the myths around maybe brain health, taking care of your brain health? There are many things that people talk about, like even in dementia, we've talked about how someone might think it's witchcraft, someone might think it's something superstitious. You could also give us like some of the myths around brain health and taking care of yourself as well.
That it's expensive.
Walking does not need money.
Walking does not need money. Another thing is getting your blood pressure checked. So some of the myths around brain health and mental illnesses, scratch that. Some of the myths around brain health and mental illnesses is something that is caused by spiritual causes. No, it's physiological. It happens in your body, and you can prevent it. Can be treated. For mental illnesses, there are medications, there are
precautions.
There are also treatments by psychologists and psychiatrists, talk therapy that and cognitive behavioral therapy that can help with that. So it's not a spiritual cause. There's nothing wrong with prayer, and because it's also boosting your resilience, but when you do it alongside pharmacological and also other several strategies at the same time, you're able to boost your mental health and your brain health. Another myth, as I said earlier, it's that it's very expensive. It's not too expensive to have
Good health.
good health and brain health if you're able to exercise, eat well, and I don't think we should be going for the most expensive food. The most affordable, accessible food, the green leafy vegetables, meats, fruits, grains, beans and legumes. Come on, all those, like they're good for your brain. Do not, eating processed food is bad for you. Too much salt in your diet, and managing hypertension has been shown to be really effective in protecting brain health for older adults, because it's one of the risk factors. High blood pressure is one of the risk factors of dementia.
That's nice. I might do all these things. I might have like good health. I might have good exercises. But maybe tell us, like, how would I be able to prioritize my mental health and be able to reduce stress? Yeah.
So it's being able to understand your emotions, and there'll never be a time when there are no stressors in your environment. So understanding yourself, how stress affects you, how you feel when you're stressed, and then knowing how to manage it. So for some people, they will speak to a therapist. For some people, they'll speak to a friend or the pastor in their church, if that helps. And asking for help is really important. If there's a solution, if there's a challenge in your life, most times people are able to help. And if people can have societies where they're able to seek help and speak openly about the challenges they're facing. But then also I'd like to point out that the government needs to develop services for mental health that cater to our young people and to the populations that they serve, and that people feel confident getting those services. For serious mental illnesses like schizophrenia, bipolar disorders, having access to good psychiatrists, medication, and a psychologist to help manage their symptoms in the long term is crucial, because people with those conditions can also live well in society.
Yeah,
yes.
It's accommodative for them.
Yeah, yes.
And maybe you've mentioned that the government needs to create more centers. For someone who's trying to get help for their mental health, where are the places you could recommend, or how can someone start taking care of themselves, regardless of the fact that the government has not created a platform for this to take place? Maybe you could tell us like some of the resources someone can use to maintain their mental health and keep them in check.
There's peer, like when I was in university, there used to be peer mental health support.
Where talking about it.
Yeah, so where like there was someone who had like a bit of training, and they would support people with their distress. So where people can access, I think they're called level 5 or county hospitals usually tend to have those services.
Yeah.
So people can seek those services. And also, if you can find, if there are online resources, I don't know whether they're the most effective resources, but there are online resources. Being able to have access to a licensed psychotherapist. Some churches have spiritual psychotherapy that can be useful for them. An effective way is to write down, journaling, writing down your thoughts and looking at them from it's someone's like, this is what I'm thinking, and what are the strategies, who can help me. And there's help that's available for people living with long-term mental illnesses.
Yes.
And to understand that it's like most conditions are treatable. In like Mathari Hospital, I think there's sometimes free psychotherapy and also access to medication and for people with those mental illnesses.
And we spoke about dementia, and dementia is in relation to memory loss, right?
Yeah.
So maybe we can talk about ways we can improve our concentration and memory so that I can be able to maintain my brain health.
Yeah.
I could read books or, you could probably tell us more about that.
So, so because dementia is a condition, and currently we don't have very effective treatments for dementia, there's strategies that can support people who have like early signs of dementia. Especially memory loss is not just the only symptom of
Dementia.
Of dementia, and especially Alzheimer's disease. It's having supportive caregivers. Like in a household, I think it's from person to person, so it's hard to give general advice. From person to person, giving cues, social cues, so that you can remember to do this thing. Having very gentle nudges by someone, not harsh nudges, to do something that you needed to do. When you notice someone might be lost, checking whether they need help. Sometimes those people might have forgotten their names and their whereabouts.
Yeah.
So it's also the government and the security services having an effective way of supporting people who have mental distress in the society to find their way back, and treating them with kindness.
Yeah, kindness and being empathetic comes a long way in supporting people. And what are some of the risk factors in relation to dementia?
So there's a very good study by the Lancet Commission on Dementia over the years has shown that we can reduce the risk of dementia. And reducing the risk of dementia can be done at a populational level and at the personal, individual level. And some of the risk factors of dementia, first of all, there are modifiable risk factors and non-modifiable risk factors. For example, the biggest risk for dementia is age, so growing old. That one you can't modify, right?
Yeah.
Sometimes there are genetic risk factors. If you have you're predisposed genetically to dementia, that you can't modify.
Yeah.
But for the modifiable risk factors, one of the biggest one is managing high blood pressure. So people with high blood pressure are at a higher risk of developing dementia, because high blood pressure destroys small vessels in the brain, and so a whole physiological process happens that makes people develop dementia. The other one is diabetes. People who have diabetes tend to be at higher risk of developing dementia.
Yeah.
Another one is hearing loss and sensory loss.
Yeah.
So if you have hearing loss, it's good that you get it corrected, because it increases your risk of developing dementia. Another one is social isolation and loneliness. That is a huge risk factor that people don't tend to think about. When older people get older, they tend to be more isolated. So it's important that we create environments for older people to socialize. A big one is low education. When people have low education, they tend to be at a higher risk of developing dementia. So it's people that
that's new.
It's important that people have access to quality, accessible education across their life course. So when we are telling the government, make sure the children have quality education and get all the way to university, you're not just telling them so that they have a good economic access to the society and have jobs and whatever. You're also increasing their brain resilience and reducing their risk of developing those diseases as they grow older. Another one is traumatic brain injury. People who tend to have traumatic brain injuries have an increased risk of dementia. So
Yeah.
wearing a helmet when you're doing when you're on a boda to reduce your risk of brain injury is important. Another way that brain injuries happen, and it's not really talked about in our society, is intimate partner violence and domestic violence. Women get hit on their heads in those situations, and it predisposes them to developing dementia and other mental health conditions. So I think we need to start measuring traumatic brain injuries from intimate partner violence, which is really important.
Yeah, gender-based violence.
And gender-based violence. I think I've forgotten the last.
Could you tell us like some of the importances of early detection of this diagnosis? Because maybe I found out I now have Alzheimer's or I have a brain health disease. What is the benefit of finding out as young as I am? And maybe is there hope for any recovery with all these treatments? Or is it a condition that I'll have to learn to live with it and accommodate myself with it? Or is it something that you're going to get cured from in the long run? Yes. And the importance is of, you know, going to get checked initially and just having these health checkups done.
Yes, so one thing I can say, I don't think you'll have Alzheimer's disease.
No, I'm asking generally, you know, for someone out there.
So, as I said, there's early onset Alzheimer's disease that happens under the age of 65.
Yes.
Right?
Yes.
And, but most of the dementia, Alzheimer's disease happens in older populations. An early diagnosis allows for someone to have agency and make long-term care planning around how they want to be taken care of, how they manage their resources, how it gives them agency, right? So an early diagnosis improves the quality of life for the person with dementia and their family.
Yeah.
Because the person can advocate them for themselves. And also it gives them access. When you have an early diagnosis and you're given the medication that are available for dementia, they're more effective than when you get a diagnosis later. So that, and also helping in participation of research. There are research projects, for example, at the Aga Khan University that are looking for people with dementia to participate in research. And if someone has progressed too far to the disease, they're not able to consent to take part in studies. But if someone is in the early stages, they can be able to contribute to science. So an early diagnosis is crucial to the quality of life for the person with dementia and for their families. So if your loved one has memory problems, they're starting to get lost. If you notice that like there's something happening, you're not functioning as you used to be.
Yeah.
You get lost in familiar places. You forget things that are simple to remember. You should seek help from a neurologist or a psychiatrist. Another thing that can be done is that sometimes people who have those symptoms, they don't know that they have those symptoms. So family members, if they notice their loved one has a problem, they shouldn't wait for it to get so bad to get help in the clinic.
Yeah.
Don't wait until a person has gotten lost and you've noticed they have memory problems or sleep issues, because sometimes you don't see these issues as medical issues, but sleep problems, getting lost in familiar places, having short-term memory loss, that could be a sign of something, and especially when it doesn't get better over time, because someone might face a stressful situation, and for a while, because they're going through that stressful situation, their memory is affected a bit, and then they recover. But then if something keeps getting worse, and you notice like someone's memory is getting worse, they're having behavioral disturbances, agitation, seek help as early as possible. For young people, if they notice their parents are changing, and they're like, their personality has changed, they're starting to forget, they're starting to get lost, all those things, please get them to get help from a neurologist or a psychiatrist.
Amazing.
Yes.
Let's talk about impact and maybe the change you hope to bring about. You could briefly tell us like a message that you'd share with our viewers back at home on the importance of mental health and, you know, dementia awareness, and where you hope your work is going to be, or the kind of impact you hope to create in those people who are supporting people with dementia and caregivers as well.
Please ask the question again.
If you
The
could
first
please,
part,
the first part, if you could please share with us how you measure the success of your work. Where do you see yourself in the few years in terms of the impact you're bringing in making change for dementia patients? You could probably share with our viewers and the young people like a message to give them some encouragement on how you can start this, how you can get involved, and where you see what type of success impact you expect to have.
For me, the impact I want to have is that people have access to the tools they need to, first of all, get diagnosed for dementia, information to seek an early diagnosis of dementia, and then if it's found that they have dementia, that they get the help they need and the information they need to manage the disease. Well, because it's a long-term chronic condition, 10, 15 years, and along that continuum. So that's the impact I hope to have with my work.
Thank you so much, Wambui, for your time. Thank you for letting us know more about you. We appreciate the work you're doing. And if you care to maybe tell us one last thing, look to the camera and tell our viewers a bit more about yourself as we close the show.
Yeah, so a bit more about myself.
As you close the show, thank you for having you. Closing remarks.
Yeah, so thank you so much for having me today. I hope you really learned something from this session. If you notice someone has changes in memory, they are getting lost, they have personality changes, please get help. Make sure this person sees a specialist and sees whether there's something that can be done, because there's always something that can be done. Let's not ignore symptoms like memory loss for our older adults and say that's just normal aging. Seek help, because help exists.
That's it from us today. Thank you so much for joining us. And as you go home, remember, compassion goes a long way in caring for people who have dementia and brain health issues. I have been your host, Loreen Kerubo. See you next time. Stay tuned, stay informed.